Dr. Gomez, I'd like to talk about just Invisalign and a little bit like what the difference of Invisalign is. It's a very specific procedure which came out of, I don't know, a while ago anyway. Explain it a little bit, some of the advantages and as well as some of the drawbacks, if there are any, But shed some light on just talking about Invisalign, what it does and what's good for, who does it fit and who does it maybe not fit.
Well, Invisalign is a type of orthodontic treatment that has a limitation sometimes not all cases can be done with Invisalign, but a lot of cases now could be done with the system because they have improved a lot since they started with. But the benefit with Invisalign is that the patient can remove the Invisalign, they can clean the teeth, they can floss. We cannot be done, in an easy way with the regular braces because with the bracket, with the wire, it's difficult for the patient to keep their hygiene. And with Invisalign, they have the benefit that they remove the aligner, they can clean the teeth, they can brush, they can floss, and that prevent cavities because with the regular braces, if you don't brush properly, if you don't keep up with your hygiene, you're gonna get decay.
And so it's more difficult. It's more difficult to brush and floss if you have braces on it than it is normally. A little bit like with a bridge. If you have a bridge, that area of bridge is much more difficult to floss and brush. And lazy guys like me will probably not do so well. I wash, shower, shave, brush my teeth, and I think my wife is still on her first tooth. At least that's how it feels to me. She will probably do well with braces or a crown. A bridge, because she would still do the job, but I probably wouldn't. Is that what you're referring to?
Yes, that's what I'm referring to because patients that have problems brushing the teeth and flossing, you don't really want to have braces and brackets and around the teeth. If they have weaker enamel, that's another problem because they can develop decay very, very easy. So the Invisalign is a good choice for those patients because they can remove the aligner, they can clean the teeth, they can floss, and they have very better more advantage wearing the Invisalign than having the regular braces because the mouth could be keep clean pretty easy.
Right. So, because you mentioned in other videos how devastating and bad a gum disease can be, so if you wear regular braces, not that regular braces are not super bad, the braces in itself are good, they do the job, you just need to pay more attention to cleaning them, otherwise you get gum disease. Now let me ask you this. So you take out those braces while eating. Well, first of all, one question, very short. Are those Invisaligns really invisible?
Yes, they are. They are. It's a clear plastic that you rarely can see them. You really have to be a dentist or somebody that really pay attention to a little detail, but it's very, very, very invisible. You don't really see it. Yeah. Beautiful. So so basically, with those Invisaligns, basically, I guess what you do is you. A computer kind of like makes up, 20, 30 different trays which you put on. It depends. Yes. It's basically the technology is you take an impression of the patient and the computer generate the whole system. Then they're gonna fabricate the aligner based on the computer analysis, and the aligner will make the changes on your teeth. So the dentist had to change the aligner every 2 weeks. And we had to put some adjustment on the teeth. We might have to cut a little bit in between to get some room if you need it. But it's not much that really has to be done. It's all done by computer. And the patient comes, as I said, every 2 weeks and get different alignment, and they can change that to brush, and they have to wear it 24 hours, but they can remove it for eating and brushing.
Right. So is there a little bit less time required for the patient to come to the dentist, since he has those trays and every 2 weeks or whatever it might be, he changes them? So is there less time needed to go to the dentist than with regular braces, or not really?
Yeah, it is. It is less time on the chair. You come in, it's like 5 minutes, 10 minutes, it depends, because on the case. But most of the time it takes only 5 to 10 minutes.
Okay. Well, all right. So there seems to be lots of advantages, and of course, there's the fact that you got to be wearing them. You cannot just go and take them away, which is why sometimes children are not good for it, as you said, because they take them out at lunch, they leave them on the desk, they start playing, and
they forgot it.
and they forgot, and then the whole damn tray is lost probably. Anyway, so there's
exactly.
that. On the other hand. And not all cases can be fixed with it, if sometimes the case is just so crooked in some way or another that it cannot be fixed. Well, Dr. Gomez, you enlightened me a lot about braces, and I'm sure you do the listeners to this video as well. Thanks a lot.
You're welcome.